Welcome back to the Better Health Now podcast. Today I sit down with Dr. Meherg, a general surgeon here at Cullman Regional. Thank you so much for joining me.
Of course.
Yeah,
My
so
pleasure.
before we kind of dive into the topic of women's health, I want to talk a little bit about your background and kind of what got you here to Cullman Regional. So talk a little bit about what ultimately, I guess, would first would interest you in pursuing the field of medicine and kind of your work you do here at Cullman Regional.
Okay. I think I always had an interest in medicine. I think sometimes people either are gravitated towards healthcare or far, far away from healthcare. And so I think I always kind of knew I wanted to go into the field, and I just kind of kept going down that track. As far as surgery, I didn't really know until I was actually in medical school whether or not I wanted to pursue surgery. And then once I did it and also did some of my other core rotations, it really kind of made me lean towards it, and I was gravitated towards it. I love it. I think surgery is great because I can fix the problem right there, then and there. You know, if I get called about somebody having appendicitis, I go and take them to surgery, and they can go home sometimes that day even.
Wow.
And if they didn't have that, that would be a major complication and could really alter their life and their plans.
Yeah, for sure. And I mean, I think, like you said, as two over the years with the surgery, I guess, continuing to evolve and continuing to get better, that recovery time for patients has gotten shorter and shorter.
Yes, absolutely. And they're always researching new ways to do things. And I think that's one of the reasons why I think it's great that myself and Dr. Bitterly were some of the newer surgeons here. And I think we bring a breath of fresh air. Yeah,
for sure. So with the topic of women's health kind of being the general topic for this for our conversation, I know that the women's diagnostics imaging is growing here at Cullman Regional, as well as the OBGYN clinics. How do you kind of balance both being a busy mom, a new mom, as well as the work you're doing as a physician and kind of working with your patients that they're able to get the screening and the appropriate checkups that they need along the way?
Right. So I'm very thankful that I have a very involved and helpful husband. That's for sure. Let's start off with that. But I also, this is something that I've worked my entire life for, to get to this point in my career, and then having children is a blessing. People pray for this. So I'm very blessed with 2 children, and but it is difficult, definitely, and we just welcomed our second. And so getting that balance, I can completely understand how patients can say, well, I'll just do it next week, or, and me trying to schedule an appointment it's quite atrocious, to be quite frank, because I work every day, and so trying to make a time for myself. So I get that, but I try to convey to my patients that you can't pour from an empty cup. So if you're not taking care of yourself, you definitely can't take care of someone else. And I think that is definitely in women's health, because women are notoriously known as the caregivers of their whole family. Everybody has a meemaw or something like that that they've taken care of everybody for forever, and they hardly ever take care of themselves. And then people bragging about, they've never been hospitalized a day in their life. Well, is that because they're just not taking care of themselves, or are they just really that healthy? And so I just try to convey that you got to take care of yourself first, so that way you can be there, in the coming years, to take care of your kids, your grandkids, or even your own parents. You have to be able to take care of other folks. And so that's what I would recommend is, take the time, do one appointment. It's not going to take, hours and hours typically to take an appointment or do a mammogram, or just a routine screening, a colonoscopy. That's really one day out of your life. And then you may not have to do it for another 10 years, but it could really change the outlook and everything if you just think about it in that sense, that this is just 1 hour or 1 day, and then you can continue trucking on.
Yeah, and I think even though, from your perspective, being a physician and knowing that these things are important, but then I think also hearing that you also are dealing with the same struggles that your patients are. Even though you're preaching, hey, you need to get your checkups, it's just as hard for you to say, I should go get my checkup.
Yes.
And even though obviously you're in the healthcare field, you're in the hospital, it's still that much harder for you, and it's just as hard. Yes. I think what's interesting too is just, like I said, you're juggling that just the same as they're juggling that.
Right.
And I think the perspective that you bring to them is probably a great perspective, because it doesn't make them feel like they're alone.
Right. Yes.
Do you have any tips for any of the listeners that might be struggling to kind of prioritize that, things that maybe you found over the years that maybe helps you prioritize your health and kind of put hey, let's allot that day, or let's go and schedule that appointment? Is there anything that you would recommend maybe helps make that first step possible?
So I'd say rely on your village. They say it takes a village. I would say rely on your village. Just as much as you need to go grocery shopping for the whole family, you also need to take the minute and go to the doctor.
Yeah.
Have these routine appointments. And, a lot of times if you stay up to date on it, so that's why if you stay ahead of it, you don't have to worry about doing a whole lot at once. You can kind of spread it out. So that would be, I kind of, okay, this month, these are things I need to make sure I get to this appointment. I would say just prioritize yourself.
Yeah.
When you're making that list of things to do, you got to keep yourself on there.
Sure.
And so I have to do that with myself. And so that, I don't know how much of advice that is, but I would just say that, when you're thinking of everybody else, also think of yourself.
Yeah, and I think adding that to the to-do list. It's not just hey, let's go get the groceries,
Right.
let's run these errands, let's pick up this stuff at the dry cleaners. It's hey, I should go to the doctor.
Make that appointment.
I've gotten that call, and I've been putting it straight to
Yes.
voicemail every single time. Now I should probably actually take that first step.
Right.
Kind of pivoting a little bit, but still kind of staying within the realm of women's health. Talk a little bit about some of the surgeries that you do as a general surgeon here that kind of ties along with maybe some of those routine checkups that patients and any of the listeners maybe should be doing.
So big screening things that we, that surgeons deal with are mammograms. And so, from that, we also may ask you that after you get the mammogram, you may need another mammogram if they have some abnormal findings, and then also an ultrasound. But we use that data to see, do you need breast surgery? Do you need, what type of lesion are you dealing with? And then also just like infectious. Sometimes you have infections of your skin, and that includes your breast. So those are some of the basic things. So we deal with, your typical just infectious causes, but big time is for as far as screening and such as cancer. Breast cancer is one of the leading causes of death in women still, and it shouldn't be like that. We have the ability to have these screening purposes, like the screening's there on purpose. So trying to stay up to date, there's always going to be something that somebody's staying up to date, and stuff still happens, but that's the type of surgeries we offer for breast in particular. And myself and all my partners, we all perform breast surgery, and this also could include males as well. I will say that.
Yeah.
But we like to make sure that we're being very thorough. If you sit down with me and you have a suspected lesion or a spot basically, a lump or something to that effect, you'll see that I straight up pull up the guidelines and I go through and make sure we check every box on that.
Wow.
And that we are going through this, because when I send you, if I need to send you to oncology, I don't want anything missed. I want to make sure that we have all the radiology reports. And so it's nice to have the Women's Center here, because everything is all in the same system. So we can see each other's notes, and that's very helpful.
Yeah.
As far as other screening, colon screening, it is at 45, not at 50. And the reason why they lowered the age is because our Western diets have made it so we have more prevalence of cancer is what we're finding. So the earlier we can screen folks before they get to the point that these small little polyps that we could have just gotten out easily become masses or spread, that's very important, and that's important for both males and females. One of the benefits, I think, as being a female surgeon is that some people don't feel comfortable. Like, these are private areas.
Yeah.
Going to the opposite gender or sex. That is, for me, I mean, that's great. That helps my business, because I want females to feel comfortable so that they will come. Okay. Does that mean that my male colleagues are not capable? Absolutely not. I would go to them any day.
Yeah.
But some people just don't feel as comfortable, and that's like whether it's religious or just personal or whatever. I'm glad that we can be there to give them the opportunity to feel comfortable enough to go make that appointment.
Yeah, and we've had other episodes, especially with the physical therapist that we had on, talking a little bit about just being able to offer that something that's it is not necessarily the most comfortable thing to talk about,
right?
But it's something that's important, and being able to have those screenings and being on top of it, like you said, it doesn't mean that if you have those routine screenings you're not going to get something.
Right.
It just means maybe we catch it a little bit earlier, because
Absolutely.
if you're getting them like you need to, which I think is huge. What does sort of the process look like as far as what the patient gets to see from having that test, having all those routine checks, to then maybe they do find something, and then that process from then finding something, sitting down with you, to maybe even having surgery. Is that a month-long process? Is that shorter, or does it just depend on the case?
It really does depend on the case. So oftentimes, thankfully we have great primary care physicians who are doing these checklists basically and saying, have you gotten your mammogram? Have you gotten your colon screening? Prostate exam, things like that. They're checking on these things. So once they check, okay, you have not gotten your colonoscopy, then they send the order so that way you can then set up an appointment with one of us to get that done, for example, or you need to get a mammogram. So you call the Women's Center, get that set up. So those scheduling things can take time.
Yeah.
Definitely, I think that, if we start to notice that there are more, it's not just screening or there's, worrisome signs, we kind of expedite that a little bit. So it's very individual.
It's a case-by-case thing, which I think
Right.
is too, is like your comment earlier of finding that doctor or that surgeon that fits what you're looking for.
Right.
And at the end of the day, you want to make sure that they're feeling comfortable. Like
Right.
your goal is to get them better health now.
Right.
And cliche as the podcast title is it's that process.
Right.
So when a patient is getting their screening and they get to the point of maybe that surgery is that next step, how do you, like, what are some maybe criteria or things that you would recommend that they think about when they're trying to find the right surgeon for the job that they're trying to do? Maybe like you said, all the surgeons there can do everything, but finding that perfect fit for them.
Right. So one thing is probably going to be scheduling, just like what day are you available, that we have office. We're in the office every day. But not all of us are in the office every day. So if you have a specific day that you can only be there at Wednesday at 9:00, I may not be the person for you, but I may be the person.
For sure.
So that's one thing. You can look online and see the different profiles, see where people trained. You can see if they have any specialties listed. So if you want to do bariatrics, for example, not all the surgeons here at Cullman Regional offer that. So that's something that if you look in their little profile, it'll say who does bariatrics, for example, and that's not a screening thing. But and then some things are going to matter to people, like gender. That's something that you can obviously see. Everybody's pictures are online. Or you can, when you call the office and they say, do you have a preference? You can say, I want a male physician, I want a female physician. So those things you can kind of look online. That's a really great resource. I mean, a lot of people have access to that now, which is great. But also just when you're on the phone making the appointment, you can ask the staff. That's what they're there for. If you have specific times or specific people that you want, ask for it.
Yeah. And I think conversations like this too that we're having, that kind of allows the listener to feel, because I think, like you said, it's an uncomfortable thing, or it can be uncomfortable. And allowing these conversations that maybe is uncomfortable for me, the host, but it is one of those things that it definitely, it's education. It's allowing the listener to kind of feel as though their stress is just alleviated, and they're able to kind of take that next right step for them. But I appreciate you taking the last little bit talking about the work you do here at Cullman Regional and about women's health. We'll be sure to have all of the links to all the information that you might want if you're listening to this or watching this in the episode notes. You can find those links there, but I appreciate your time.
Of course. Anytime.